Hello, everybody. My name is Dr. Erin Seedorf. I am from the Department of Health Professions at Metropolitan State University of Denver. And this presentation is titled Community Health Workers, Building a Critical Public Health Workforce Through Competency-Based Training and Higher Education Academic Partnerships. I'm thrilled to be able to join you remotely to share a very exciting initiative we've had in the state of Colorado and also specifically at MSU Denver. So again, my name is Dr. Erin Seedorf. I'm an associate professor in the Department of Health Professions. I also serve as the assistant chair for our department. About 3 years ago, I developed a brand new undergraduate degree in public health, a BA degree. And so now I have served as a faculty member in the MSU Denver Public Health Program for 3 years. I'm also the faculty coordinator for our MSU Denver Community Health Worker Training Program, and that's why I'm here today to present information on what we've been doing in this space, in this very critical space. So let's review our session objectives for this presentation. So our first objective, we're going to define the unique characteristics that distinguish community health workers, or CHWs, and we're going to distinguish those roles from other related occupations, including a range of roles and functions that are service areas within our public health and local communities. In objective 2, we're going to examine trends and growth for the community health worker role and opportunities, particularly examining a specific state context of within Colorado. And then our final objective, objective 3, we're going to identify opportunities for community health worker training in institutions of higher education. And we're going to have a specific example of MSU Denver applied. Okay, well, let's go ahead and get started with objective 1. So again, objective 1 is to define the unique characteristics that distinguish community health workers from other related occupations, including the range of roles and functions they serve in public health and local communities. So we need to start by thinking about what a community health worker is. And I'm going to borrow this illustration actually from the Connecticut Health Foundation. And they really took this opportunity to look at a day in the life of a community health worker. So here in this illustration, we see Carmen, and Carmen is a community health worker at a local nonprofit. So this illustration talks about how community health workers like Carmen can go by many different titles, and they also can work in a variety of different organizations like clinics, hospitals, and insurance companies. So in the picture, you also see Carmen, and you see on the badge, there are several different titles that could go on Carmen's badge. One is a promotor de salud. One is an outreach worker. One could be a patient navigator. Another is a health advisor. We also can see community health representative, a health coach, or even a peer counselor. So this is just to demonstrate that community health workers in our practice can go by a variety of different titles. And we're going to further drill into that to really see what are the unique aspects of what a community health worker is. So to define the role of community health worker, I'm going to borrow a definition from the American Public Health Association, where they define a CHW, or community health worker, as a trusted member of or someone who deeply understands the community which he or she serves in. They also are a liaison between health and social services within the community. So then going even further into that definition, we are looking at what CHWs, or community health workers, do within working with individuals or even within our communities. So some of the capacity or the roles that they're taking on, they serve as outreach. They can serve in the capacity of doing community education or health education. They can also serve in the capacity of providing informal counseling, social support, and also advocacy for populations who often are underserved. So that was kind of a long-winded or a little bit more complicated definition of what a community health worker is. But if you were to really kind of hone into two key aspects of what a community health worker is, I really have identified these two as being pretty critical. So one is that community health workers have some formal or special relationship with the community that they're serving. So whether that again is that they are housed within a community or they have had a long-standing kind of relationship or special connection with a specific community, that is what's unique about these roles. Um, Community health workers also exist for some underlying purpose, really trying to address any sort of access needs, or in the role of promoting health equity, particularly in our underserved communities. And so these are two key aspects that I think are critical when we're thinking about what a community health worker is. So a community health worker is really a broad public health term for an entry level position potentially, and so historically we've seen nationally that there are lots of different titles that a community health worker can go by. And you see on the screen here the box shows a variety of titles that a community health worker might have. So it could be a casework aide, community care coordinator, community health advocate, community health promoter, community health representative, community health worker. That's the more specific. Community health aide, health service worker, HIV peer counselor, lactation consultant, lead abatement outworker, maternal infant health outreach worker, neighborhood health advisor, outreach specialist, patient navigator, peer educator, promotora de salud, public health aide, or a variety of other titles. So it is a community health worker can serve all of these different roles because of the variety of skills that they can bring to the table to really serve a very unique aspect of a community. So now let's look a little bit more specific at the role and function of a community health worker. So these are just some examples of some of the roles that a community health worker may serve, but there are obviously more that we've seen traditionally in public health practice. So, to name a few, a community health worker could serve as a cultural, to provide cultural mediation between communities and providers in the community. So, really being that liaison to provide direct connection between services and providing context for those providers in a culturally relevant way. Community health workers may help patients navigate healthcare and social service systems. This is an area that in Colorado we had a field of health navigation that has now rolled into this larger umbrella term of community health worker. And we'll talk a little bit about that later in this presentation. But patient navigators are a very key role that we see often our community health workers take on. Community health workers also can provide culturally appropriate health education and information, again, tailored to unique aspects of that particular community. They can also serve to provide informal counseling and social support. But again, I think the important distinction here is that it's informal counseling. If it's a higher level of counseling, that is when we're seeing a partnership with a different provider. Community health workers may collect data. They also can relay information to stakeholders to help inform program or policy decisions. In that space, they also can advocate for individual or community needs because they have those direct connections with the community context. Some community health workers may provide direct services, and this actually happens in more of our remote or rural areas. But this is done in partnership with a different service provider. But the goal is to really, again, meet the needs of that particular community. And really, overall, community health workers are striving to build individual and community capacity to really seek out health equity and promote well-being. So, what are, again, unique characteristics of the community health worker? Some of this is a little bit of review, but community health workers are different because, one, they do not provide clinical care. They are not licensed to do direct care aspects. That's why community health workers also often seen in partnership with other health professionals in those service spaces. Community health workers are different because they relate to community members as peers rather than purely as clients. And so this really is building on identifying and building those relationships and trust rather than focusing on kind of the clinical expertise that might be in other roles in our healthcare professionals. Also, expertise is based on that shared cultural and life experience with the population that they're serving. So those are those two pieces that really make them unique in a healthcare service system. And then lastly, community health workers generally do not have other professional licenses. However, there are cases, particularly in our rural communities, where we might have a community health worker who is serving in multiple roles and might have licensure in one of those service areas. It's important to note that community health worker roles do often overlap with some other roles that are in different occupations. So there are different professional spaces that might be performing tasks or functions in our healthcare settings that are similar to community health workers, but they're doing it within a specific practice area. So, for example, care management and coordination, we talked about that as a role of a community health worker. Two examples of other related occupations that might be doing that could be nurses and social workers. So let's go into health education, again, one of the community health worker roles. But we also see in related fields, we have nurses who can do health education, health educators who can be very specific or can be community health workers, diabetes educators. So those can be community health workers, but have this specific training and expertise in the diabetes space. And then dental hygienists also do provide health education in the dental area. So then a next role would be counseling. And within, counseling can be a role that a community health worker does take on. Again, it's kind of basic counseling services, not specific, where you would see social workers and therapists who have specific licenses, who are licensed to provide a much deeper level of care. Community health workers can provide kind of a surface level of interaction with the patient, but then often there's a referral to a higher level and more specific care in kind of the counseling space. Patient follow-up. So we do have community health workers that help in that care coordination aspect, but we also see that within nurses and medical assistants, those roles can happen. And then direct care. Again, this is not often an area that community health workers work in. However, there are spaces, particularly in underserved geographic areas, whether they're rural or just under-resourced areas where there could be some direct care, but most often in communities, we're seeing that provided by our nursing assistants, professional care aides, etc. Okay, so I want to have a checkpoint here. I know this is a recorded presentation, but if you have any questions that that have come to the surface about a community health worker, what the role is, how we can differentiate between other roles in our communities, I'd like you to take note of those. Take a moment here to write those down, and then be sure to submit those through the NACCHO portal system, and I will be sure to provide any sort of resources or information that I can in that space. So take a moment at this time. Or actually, I would have you pause the recording and write down that, and then we can restart the presentation. So if you've already taken your notes or you don't have any notes to take, we're going to continue on. So we're moving on to objective 2, which is really examining the trends and growth for community health workers within our communities. And we're going to look a little bit at that nationally, but then I'm going to give you the specific example of our Colorado context and how this professional space is in this kind of well, expanding role in our public health and healthcare spaces. So, why is there an increasing interest in community health work? So, community health work is not a new role. That's been a role in public health really since the beginning of public health. However, we have seen an increase in demand for public health professionals who have a community context, who have that expertise in the community and can serve as an advocate in that space. So some of the factors that have led to this increasing interest is the reality that our populations have become much more diverse. And with that diversity, we see a lot of underrepresentation of populations, underserviced areas and communities who are feeling challenged by accessing particular care areas. And so being able to provide community health workers who can really enter into the community and advocate for the needs of that community, we're able to address a little bit more of the diversity that we see. We also know that there has continuing to be a prevalence of chronic and infectious disease. And many of those conditions require continuous care. And so being in that space of helping to provide support to patients to follow through on those different levels of care, community health workers can serve a very important context in that care cycle. Connecting to that is the growing complexity of healthcare and healthcare services, whether that's insurance or when we're going down and thinking about social and behavioral determinants of health. That lends to very complex ways of patients engaging in care. And so community health workers can help navigate that complexity for the patients and also for the providers to really be able to provide culturally relevant, culturally based care. We also are seeing a strong push in the public health spaces to commit to reducing health inequities and using trusted and specially placed community members in this community health worker space can authentically create ways to really address some of those underlying health inequities and work on reduction. Cost pressures on the system. So we know that healthcare costs are soaring, have been, and continue. And so being able to provide interventions like community health workers who can perhaps either do prevention work or do very specific work with patients might alleviate some of the breaks in the system, whether that's non-follow through in care, and then the care that we end up delivering to patients is much more advanced because that care had been interrupted. Whatever it may be, community health workers have been shown to provide some support in the care process, hoping to address some of the pressures that we do see in cost. And then, of course, we know that there are shortages of clinical personnel, which limits patients' access to care. And so being able to use community health workers as a liaison between where we do have some holes or being able to follow up on care in between a long wait period for patients, we're just really able to provide a better wraparound care for our patients in this way. So, looking to some data, we looked at actually the U.S. Bureau of Labor Statistics and the Occupational Outlook Handbook. And we looked up community health worker projections, and this was done in about 2023, 2024. And at that time, it was identified or expected that there would be a 14% growth from 2022 to 2023 in this space of community health worker. And it was noted in that this is actually much faster than the average for all occupations. So this really has been identified as a fast growing, high need space in public health, but also just in healthcare in general. This report also noted that they expected to see 8,000 or more than 8,000 openings for community health workers each year. And I will say, knowing how things have developed even over the past year, we're seeing that even increase. Part of that is because we have seen a stronger focus nationally on trying to create community health work roles within public health organizations, healthcare organizations, nonprofits, that type of thing, again, to address these service needs. We're also seeing the formalization of community health work as a recognized field, meaning that there are competency areas that have been established in the and promoted to these different spaces in healthcare and public health. We're also seeing reimbursement models coming up nationally, and that's where we're going to go specifically with Colorado, because that is the process that we have gone through in really formalizing community health work as a practice area, and then creating a mechanism for reimbursement within our healthcare settings. So then let's move to our Colorado story. So in Colorado, we had over the past 2 years we've been working on the formalization of community health, establishing community health worker as a very formalized role in our healthcare system, public health and healthcare system. And so it took a little while, but we did pass Senate Bill 23002. This was passed by the legislature in May 2023. It took a couple of years to get there, but what this did is it added community health worker services as a first Colorado benefit. And it was starting in July 1. This actually recently changed, and due to budget changes and budget proposals, this has been delayed a bit, but starting January 1, 2026, there will be a reimbursement mechanism within the Medicaid program in Colorado to use community health services as a Health First Colorado benefit. Very excited about this possibility. So within that, beyond just having the bill passed in the state, we also, to do that, had other aspects that were developed. So we have an approved Colorado-specific community health worker competency model that is identified in the legislation, and it was formalized within our Colorado Department of Public Health and Environment. So that was the first thing that was established. From our competency-based model, we were able to establish training center requirements and an approval process for organizations to become identified training centers with the state of Colorado. So that is also in play. We have a process for organizations to apply to become training centers. They have to designate how the curriculum or the training materials and processes fit within the required competency model that the state has established. So there's a couple of things that are in process and very close to being completed. In Colorado, we will have a competency exam in order for organizations to bill community health worker services to Medicaid, they will have to have passed this competency exam, and they will have to be listed on the registry, which is the next piece. And so we are formalizing the final exam that is supposed to go live starting July, probably mid-July. And then from there, we will be establishing our registry. There's a soft release that has happened right now because we actually have community health workers in the community that we have established and are putting into the system, but it will go fully live in January with the initiation of the bill. All right, so now is another checkpoint. So the question that I want to pose for you now is, what questions do you have about the growth of community health work as a field nationally, or any sort of specific questions that you have about the context of Colorado? So if you do have a question, pause the recording now, take note of that, and send that through the presentation questions. But if you don't have any questions, then we will continue on with our final objective, which is objective 3. And objective 3, we're going to identify opportunities for community health worker training programs within institutions of higher education. And I'm going to give you the specific example of MSU Denver. So again, community health work is not something new. And in fact, even training in community health work is not necessarily new. There are training programs throughout the US. There are training programs in nonprofits, in some of our federal agencies have training programs around community health work. Our training centers may have training specific to community health work. And the reality is that there are a variety. And then if you drill down even further, if we're looking at the specific context of higher education, there are many models of training programs within the US in institutions of higher ed. So in looking at that, we know that in that variety, there's a variety in time and credits that are required. And specifically, we looked across those programs and saw that they could range anywhere from 6 credits. And that I'm giving an academic context. So in an academic context, we think about time in a training program related to classes. And so a general class, an average class is 3 credits. So we do see some training programs that could be 6 credits, which might be about 2 classes to complete, all the way up to 20 credits, which is more, is above 5 to 6 credits. 5 to 6 classes. Usually it's the state that kind of determines what those requirements may be. In Colorado, again, we have determined a criteria for our training centers to be able to establish themselves. In Colorado, we have to designate that, again, as a training center, our training curriculum hits all of those competency areas. And we have to demonstrate a certain level of interaction with our students, our participants. Beyond that, even within our state, there's a variety of different ways that our training programs are delivered, whether they're non-academic and community-based organizations, or like we have at Metro, MSU Denver, which is a course-based certificate program. So I'm now going to move into thinking or to demonstrating to you or illustrating to you how we have specifically developed our training program at MSU Denver. So based on the competency model that has been established for the state, we determined that our curriculum within our public health program had 5 courses that were hitting the required competency areas. So for us at MSU Denver, we actually have a certificate program because we have reached the level of 5 classes. We're able to actually offer a formal academic certificate. So that is 5 classes or 15 credits. For students, we've been able to work with students to complete that in 2 to 3 semesters based on the kind of load that they would like to take on. For our certificate at MSU Denver, it can be either a standalone certificate. So we have students who are coming back to our institution to do this specifically, or it can be done within a degree program. Many of our public health students take well, they are required to take 3 of the classes in the certificate program, and so there's just an additional 2 classes that if they choose those for the electives, they automatically can qualify to get the certificate within their public health degree. And there are other degree programs with the use of electives where you can actually do the certificate within the courses that you're completing for your bachelor's degree. Another key aspect of our MSU Denver certificate is that our students or community members who complete the certificate can do that either within our traditional course settings. So that is like every higher ed institution by the semester. So we have courses that are offered in our fall, spring, summer semesters. So students can complete those courses. All 5 of those courses are offered within our traditional structure. Or, and this is unique to MSU Denver and actually kind of unique, at least as far as we've seen around, we actually have an outside process where our community members can complete these 5 classes in a self-paced format. Still the same content, still the same faculty interaction. It's just that it's not structured on that kind of strict academic schedule. It can be more of a self-paced piece. And this is actually within our lifelong learning program. And specifically, it's our lifelong learning program has this within our career launchpad. And I'm going to show that to you here in a moment. But again, just to highlight, our community health worker is a certificate program, academic certificate program with a variety of ways that people can complete it. Okay, so in our MSU Denver Career Launchpad, we have a variety of different topic areas that students can engage in. This is an illustration specific to our community health worker training program. And we want to show this because this demonstrates how students have an opportunity to kind of stack their academic experience and use the certificate to help stack that academic experience. So we do have people who have engaged in our curriculum in an informal way. So we do offer all of those 5 classes as separate things within our career launchpad. You can just take the foundation of community health worker. You could just take principles of public health as independent self-paced courses. That may lead you to have, at least a context to enter into the workforce, and that's what this illustration shows. But it's not going to get you that specific certificate or qualify you to sit for our Colorado State licensing exam. So that's that first kind of pathway. The second stack is where students will do all 5 of the classes, and they can do those again in the non-traditional format or in the traditional format. Either way, they roll into an academic certificate for MSU Denver. And then once they've completed that academic certificate, we enter them into the state system so that they can qualify to sit for the state exam. And of course, if they pass the state exam, then they're put onto the registry and then they can enter into the workforce. The third pathway here, or stack, will be for those who are wanting to add this academic certificate into their degree program. And we've had students who have started in our degree program and added the community health worker certificate into that. Or we've had students who are in the certificate program and then decided, hey, I have an incomplete bachelor's program. I'd like to finish out a bachelor's degree. And so they've been able to access in that way. So, at MSU Denver, we're really trying to see students where they're at, as a university as a whole, but really specifically with this community health worker training program, because we know individuals who are wanting to be in the space of a community health worker, they're in the community, they have that knowledge, they have that expertise, and we're wanting to create multiple avenues for people to get the training experience that they need to apply to the context in which they're already serving. So that comes to the end of our presentation. Again, as a checkpoint, I would have you pause if you have any questions, or the question here that I'm posing is, do you see a way to apply a community health worker training program to your students' professional or academic goals? So if you have any notes about that, definitely make sure to take note of that now, submit that through the portal, and I will try to address as much as I possibly can. So that wraps up our presentation. I really want to thank you for joining me today. This is a new and exciting area for MSU Denver, a new and exciting area for the state of Colorado. A lot of things are being rolled out as I speak. And so hopefully we can continue to check up and present even more information in the future as those pieces unfold. Just to note, in this presentation, you will find not only the PowerPoint presentation, this recording, of course, and you'll also see a flyer that gives you information specific to our Career Launchpad. So if you'd like to check that out, feel free to do that. Again, reach out to myself at eseedorf@msudenver.edu, and I'd be happy to answer any questions. Thank you so much for your time. I hope you're enjoying your time, whether you're virtually attending the NACCHO conference or attending in person. I wish you all the best. Public health, we're out there doing the good fight. And thank you. Thank you for your service. Thank you for your contribution. Have a wonderful day. Bye-bye.